Is CBAVD always linked to cystic fibrosis? Imagine a man who has no vas deferens, the tubes that carry sperm from the testicles, but shows no signs of lung or pancreatic problems. Could this be related to cystic fibrosis? The answer is complex but fascinating. Congenital bilateral absence of the vas deferens, or CBAVD, is a condition where both vas deferens are missing from birth. It is strongly associated with mutations in the cystic fibrosis transmembrane conductance regulator gene, known as CFTR. This gene is responsible for cystic fibrosis, a condition affecting the lungs, pancreas, and other organs. Most men with CBAVD, between 80 and 97%, carry mutations in the CFTR gene. These mutations disrupt the function of a protein involved in ion transport in epithelial cells, which line many organs. When this protein doesn't work properly, it can interfere with the normal development of the vas deferens, leading to its absence. In men with classic cystic fibrosis, about 95 to 98% have CBAVD, making it a common reproductive system impact of the disease. However, not all men with CBAVD have the full spectrum of cystic fibrosis symptoms. Many may have no lung or pancreatic issues at all. Instead, they often have milder or different CFTR mutations that mainly affect the reproductive system. These cases are sometimes called CFTR-related disorders. They involve mutations that cause limited or atypical CF symptoms, often restricted to the absence of the vas deferens. Interestingly, some CBAVD cases are not linked to CFTR mutations at all. Around 3 to 20% of CBAVD cases have no identifiable connection to CFTR. Instead, they may result from other genetic factors or developmental abnormalities unrelated to cystic fibrosis. For example, some men with CBAVD also have kidney malformations or other congenital issues, which suggest different underlying causes. In summary, CBAVD is closely linked to mutations in the CFTR gene and is considered a reproductive manifestation of cystic fibrosis or CFTR-related disorders. But it is not always associated with the full disease. Many men with CBAVD do not have the classic lung or pancreatic problems of cystic fibrosis, especially when caused by milder or different CFTR mutations. This distinction is important because it influences genetic counseling and fertility options. Men with CBAVD often undergo genetic testing for CFTR mutations and may consider assisted reproductive techniques. Consulting healthcare professionals is essential to understand individual risks and options. From a broader perspective, CBAVD highlights how mutations in the CFTR gene can impact multiple body systems beyond the lungs and pancreas, affecting reproductive health in particular.